Thanks, Inam, you did a great job. So I've a lot to live up to here in terms of chairing the next three presentations. So we're going to start off then with the topic evaluating communication skills teaching in relation to patients with limited English proficiency and exploring undergraduate medical student perspectives. So, and this is going to be delivered by Sudipta. Have I pronounced your name correct? Apologies.
Yes,
okay, thank you very much, Sudipta. So whenever you're ready then.
Okay, thank you. Hi everyone, I'm Sudipta. I'm currently a fourth year medical student at Barts in the London School of Medicine and Dentistry. And today I'm going to talk about my research project that I did as part of my IBSc in medical education last year. And that's on evaluating communication skills teaching related to patients with limited English proficiency, and also exploring some of the medical student perspectives to that teaching. Next slide, please. So limited English proficiency is defined as being unable to speak, read, write, or understand English. Could we go to the last slide, please? And at a level which permits an individual to effectively communicate with their healthcare professional. So 2% of the population in England and Wales have limited English proficiency, and this is even greater when considering the area that Barts is actually based in Tower Hamlets and Newham. It's a particularly important topic as poor communication between doctors and patients due to language barrier can lead to problems with developing rapport and also inaccurate medical treatment. Next slide, please. So the project aimed to evaluate the communication skills teaching through document review and content analysis, and it also aimed to explore these medical student opinions through semi-structured interviews and a survey. The next slide, please. So 21 fourth year and 1 final year medical student was interviewed, and 24 students were surveyed regarding these sessions at the university. Next slide, please. What we found was that 4 out of all the 25 communication skills sessions which takes place throughout the whole of medical school did relate in some way to communicating with LEP patients. Some key findings, however, was that previously interpreter role play scenarios used to be used to try and train medical students in communicating with LEP patients, but actually for this academic year it was chosen not to use this scenario to save 40% of the simulated patient budget. Next slide, please. One particular thing which also came up in interviews was a situation which a medical student was actually told by a doctor to interpret due to their appearance. However, they couldn't speak the language and was still told to try. Next slide, please. It was also found that students' confidence did increase by 1 level. So it did, most students' confidence did increase by 1 level. So it did show that teaching can have an impact on this confidence. Next slide, please. Essentially, the results showed that the frequency of teaching and practice communicating with LEP patients should be introduced earlier and should be increased. And many feel time pressured, so this could be introduced and at a allocated time during placement. Next slide, please.
Time. Sorry, Sudipta. Yeah. Thank you for that presentation. We were out of time.
That's okay. Thank you for listening, and I'm happy to take any questions.
Thanks very much, Sudipta. Just to echo what Inam said, that was a wonderful presentation, and is something that is new to me actually in Queen's. In terms of communicating with patients who do not speak English, I think that's a wonderful initiative. I see Rebecca has her hand up. So Rebecca, I'll come to you first.
Hi, this is a subject really close to my heart. So I'm just wondering, you had students often asked to interpret, and there's often a lot of assumptions made about what languages they speak and their competence level in that language. Just as an example, one of my students was asked on her Obs and Gynae placement 13 times to be an interpreter. And she said she'd learned her Urdu from her granny and she didn't know the words to take a sexual history. So I think this is something that really needs addressing. So well done for doing this piece of work. It's great.
Great, thanks, Rebecca. There is a question in the chat here. So a couple of things. Yes, why did you choose to do this research project?
So exactly as Rebecca said, actually, I've been a medical student on placement many times who has been asked to interpret, especially as I come from a Bengali background, and Barts being in the area that it is, a lot of Bangladeshi patients come in, and I have to sort of help in some way. It does make me feel good to kind of increase their patient satisfaction, so I do try and help wherever I can, but at times I am felt left feeling a bit uncomfortable because I don't, as I said, as you said as well, there are sometimes sexual histories and I haven't actually been taught how to kind of say any of those words in my language, so it is something that's why I chose to do it, because I thought that my medical school didn't actually adequately prepare me in those situations. I did see that someone had sort of written what other take-home messages that there was. So I think one thing that really stood out to me was the fact that reporting structures should be made available, because some of these students that I talked to, they actually did feel very uncomfortable, that they felt pressured into that situation to interpret, and they couldn't really say no to the doctor to not interpret. However, they did feel like being useful in some sort of way. So I think the use of student interpreters needs to happen in a reliable format.
Okay.
Thanks, Anam. We could talk about this all day, so that's the problem. It's so interesting. So good luck with the rest of it and taking it forward. And there is other questions in there, and if you do want to deal with them, through the chat. Then thank you so much. That was really interesting.